Hello, I'm your Professor Brenda Koeller, and in the last class you learned how to draw an ABG and the basics of that. So as a review, what is an ABG? Yes, correct, arterial blood gas, gases that are dissolved in your blood and drawn from an artery. The learning objectives for this class are for you to be able to learn and recognize the normal ABGs, as well as be able to interpret the ABGs and identify what state the patient is in if their numbers are not in the normal range. So first of all, let's go over the normal numbers. Now I told you to memorize the numbers last week, and then we'll tell you what they mean this week. So first of all, this is the pH scale. It goes from 0 to 14, and right in the middle is neutral. And what do you think is a neutral fluid? Water, correct, yes. But our body fluid is not neutral like water. It is a little more alkaline. Here, these two lines here show you the very narrow range that our pH can be in to maintain an acid-base balance and keep us in homeostasis. So it's 7.35, remember those numbers from last week, and 7.45. Okay, that's the normal range. And then what we learned this week is if you go below 7.35, you're in what state? An acidic state, right, acidosis. If you go above 7.45, what state are you in? Alkaline, correct. Okay, so that's the number we look at to decide if the patient is in a normal range for their pH, their acid-base balance, or if they're on the acidic side or the alkaline side. Okay, so we're going to take that a little further. First of all, some people say, how low can it go? 6.8, I put red dots here, and 7.8. 6.8, if it's below 6.8, that is death. Above 7.8, that is death. Our bodies cannot function. So you can see even this range, it's a very narrow range our bodies need to be in to be balanced and in homeostasis. Okay, now what causes the acid here and what causes the alkaline or the base here? I drew a little picture of a purple kidney, if that makes any sense to you. That's bicarb. That's the formula. HCO3, negative there, bicarb. And that's the metabolic system. Your kidneys regulate how much bicarb your body holds on to or how much it wants to get rid of to help buffer that blood to make it in the right pH balance. Over on the acidic side, it's carbon dioxide. And what regulates that? I hope you recognize my lungs here. Lungs, it's the respiratory system that regulates that. So we need to know the numbers in addition for carbon dioxide and bicarb, and you learned those last week also. And as a reminder, what is the range for carbon dioxide? That's correct. Do you remember the numbers? I said, look at this 35 and 45. That helps me remember. So it is, as you mentioned, 35 to 45 is the normal range, okay? And then we look over at the bicarb side, and those numbers, if you can think of a way to remember them better, let me know, but I just remember they're 22, that's right, to 26. I hear somebody calling it out there. Thank you for memorizing the numbers. That's great because you need to know these, and you'll need to know them for your state board exam too. So make sure you know those. Okay, so when we do blood gases and we're looking at them, now you know if somebody's carbon dioxide is within this range, it's normal. If their pH is within this range, it's normal. And if their bicarb is in this range, it's normal. But what happens if they're out of that range? And what's going on then? Well, let me show you. I covered this up so it wouldn't be distracting at first. So we're going to now evaluate some that are not in the correct parameters. They're not normal. And you can help me determine what's wrong with them. Okay, so we'll look at the first one, carbon dioxide. This is the respiratory system, carbon dioxide. Remember, carbon dioxide, carbonic acid. Carbon dioxide turns into carbonic acid in your body, so that's the acidic side, okay? So now, is the carbon dioxide within 35 to 45? No, it's not. This number's off. So what system is messed up? What are we having problems with? It's the respiratory system. So respiratory, okay? Is the bicarb normal, 22 to 26? Yes, it is. Is the pH normal, 7.35 to 7.45? No, it's not. It's too high. So we're on the alkaline side, okay? So this ABG you would read as the patient is in respiratory alkalosis, okay? And one thing, reading fast here. So what did I just demonstrate poorly? Right, hyperventilation. That's something that can cause respiratory alkalosis. And again, next week you're going to be learning what causes these, what diseases you'll see these in, and what you as a nurse can do to intervene, and what nursing interventions you need to do. So if you're breathing out too much carbon dioxide, it's low. I'm breathing too fast, I'm getting rid of too much acid, then I'm going to become alkaline. So this is respiratory alkalosis. Okay, the next one. Carbon dioxide, is it in the normal range of 35 to 40? No, it's a little too high, so there's a respiratory issue here. Okay, is the bicarb okay? Yes, it is, 22. Is the pH within the range? No, it's a little bit lower, so what is it? It's acid, so acidosis, so we're going to put acid. Okay, so this person's in respiratory acidosis, okay? Someone that has a narcotic overdose, anything that suppresses respirations, they're not breathing real well, they're not exhaling enough carbon dioxide, and they become a little bit acidic then, okay, and they get into respiratory acidosis. Okay, the next one is the carbon dioxide okay? Yes, it's in the right range, 43. Is the bicarb okay, 20? No, it's a little low. So we know it's a metabolic issue, okay? And is the pH okay? No, it's too low. What is it on the acid side? Correct. So this patient's in metabolic acidosis. And the last one, carbon dioxide needs to be 35 to 45. Yes, that's okay. Bicarb needs to be 22 to 28. Nope, too much. Metabolic issue. What about the pH? It's too high. It's on the alkaline side, so it's alkalosis. So this patient is in metabolic alkalosis. Okay, does anybody have questions about that? Anybody feel comfortable? Everybody feel comfortable with that now that you know the numbers? Okay, it takes a little practice and just looking at the numbers. Yes. Okay, oxygen. Yes, oxygen is one of the numbers you will get when you get your ABG report. And you will be learning those numbers next week and how that goes in with this. Also, you'll be learning a lot about electrolytes and how those affect your ABG reports, especially potassium. So make sure that you know these numbers. I've given you all this handout that I'm sure you're taking notes on now. And so hopefully you'll feel comfortable with this next week when we dig into more about what causes these and how we as nurses can take care of those. Are there any other questions? Okay, well, first of all, I wanted to remind you our objectives were to recognize the normal parameters, which you did, of these ABG components, and to be able to interpretate these ABG results and understand if the patient, what kind of balance they're in or they're out of, and to identify when they're in metabolic alkalosis or acidosis or respiratory. So you did a very good job with that. I appreciate it. Now, what I would like you to do is I have a little card on everybody's desk. Please write down, one, what you thought was most valuable about this that you learned in this session, and two, what was the muddiest point? You know, we need to clean it up. What is a little bit foggy in your mind that you don't quite understand yet and you'd like to learn a little bit more about? So turn those in before you go out the door. And I want to thank you very much for your attention to the class and learning about the ABGs. And we're going to learn so much more next week and through the rest of the term. So thank you very much for your attention.